Are you finding it more difficult to get around? Well, your aches and pains could be caused by arthritis. Dr. Robert Hynd is a rheumatologist at the McBride Clinic and joins me now with more on this. We appreciate you coming in.
Thanks.
What is arthritis?
It's tenderness and swelling in a joint. And you might notice stiffness, particularly in the morning or after you've been sitting for a while, and it may take more than just a couple of minutes to loosen it up.
Right, to loosen it up. Okay, we want to talk about the symptoms of arthritis. We want to put it up on the screen as you're telling us what it is. Obviously, pain.
Yeah, pain when you first start motion often occurs, and you notice that there's something holding you back. It's stiffness and inflammation. You may see heat, redness, swelling in a joint. There could be damage to a joint. For instance, you might feel like something clicking or popping in your joint. This could be damaged cartilage, like an osteoarthritis. And you may notice the muscles are weaker, like when you get out of a chair or out of your car, it may be more difficult or to climb a step because the muscles around the arthritic joint are getting weaker. And you might notice that as you walk, your joints are not, particularly your knee, would be unstable.
So, you know, we hear a lot of times that often when the weather is cold and wet, that people are feeling those pains more. Is there something to that?
There probably is, but we haven't been able to actually prove what it is. Could be barometric pressure changes, could be coldness. A lot of people don't like the cold. Could be high humidity. And we do hear quite often, like on a day like today, a lot of my patients this morning in my clinic said, oh, this weather is really killing me.
Yeah. Are there lifestyle choices that can affect arthritis?
Sure. If you keep your weight down, if you try to concentrate on three things. One is balance, one is aerobic activity, and one is muscle strength. Those, if you can combine an exercise program so that all those things will come together, this would really help you no matter what kind of arthritis you have.
Right. It sounds like you need to have a fitness program going.
You really do, and especially because people live a lot longer than they used to.
Can arthritis be prevented?
That's a really good question. We think that osteoarthritis of the knee would be the simplest thing to prevent because we know that there's a strong relationship between weight and the platform pressure on your tibia in the knee. So, for instance, if you lose a pound, you take 4 pounds off your knee. So there's a lot to prevent there.
It does make a difference. You know, people are out there and they say that you can get these over-the-counter herbal remedies. Do you believe that these work? Well,
there are some small studies that tell us that glucosamine may be helpful to relieve pain in osteoarthritis. So I ask my patients to try, say, 750 in the morning, 750 milligrams in the evening. And if it does help them over a period of a couple of months, then they can stay on it. We do not have good evidence that it helps long-term enlarged joints like in hips or knees.
Okay, well, it's something to watch. And treatment for arthritis?
We have lots of good treatment for arthritis, especially for rheumatoid arthritis. And we have what are called biological agents now, which have overall, in my opinion, less side effects and a lot better joint preservation. So now we have over 50% less surgery for rheumatoid arthritis patients than before these medicines.
Good news.
Yeah.
All right, Dr. Hynd, we appreciate you coming in.
Thanks very much.
Thank you so much. And for more information on the McBride Clinic, click on our website, news9.com. Look for the Scene on News 9 tab and scroll to First at 4.